Welcome everyone to this session on Frontiers in Health Informatics at the University of North Texas. My name is Anna Cleveland, and I am a Regents Professor. I have the Sarah Law Kennedy Endowed Chair, and for the purpose of this presentation, the most important thing, I am the Director of the Health Informatics Program. I will start by giving you some background about UNT and our Health Informatics Program, and then we have a wonderful panelists that they're going to describe their job and their careers, and they're all graduates of our program. So the first thing is that to let you know a little bit about the University of North Texas, and it is situated 30 miles from Fort Worth and 30 miles from Dallas. It's just like a triangle. And we are part of what we call the UNT system, which you have UT Dallas, as well as the UNT Health Sciences Center, which is located in Fort Worth. Along with our campus here in Denton, we also have a campus on Frisco. Now, our university is the 30th largest public research university in the United States. But one of the things that's even important and a major accomplishment for us in the most recent years is that we are ranked as a Tier 1 research university. Also, we're very proud that we have been designated a Hispanic service institution. And just to give you an idea of the scope of the kind of programs that we have, we offer 109 bachelor's, 94 master's, and 36 doctoral programs. Next, please. So in terms of looking at more specific at the Health Informatics Program, first of all, we want to tell you that we are a nice school, and our house, it is in the College of Information. The College of Information has basically 3 departments: the Department of Linguistics, the Department of Learning Technologies, and the Department of Information Science. And this has been very beneficial in terms of curriculum development, as well as the offerings that we can give to our students. For example, the Department of Linguistics, we can have computational linguistics. The Department of Learning Technologies, there's a number of courses that we deal with cognition. And of course, when we come to the Department of Information Science, we have information science as well as data science that now is being absolutely a plus for our students. Within the Department of Information Science, we have the Health Informatics Program. And when we look at the department, the Health Informatics Program, actually we have a Bachelor's of Science, and that is the concentration in health information along with health informatics. At the master's level, we have a concentration in health informatics as well as the doctoral program. Now, looking at more in detail about the history of our Health Informatics Program, actually our Health Informatics Program started in 1988. And the main focus at the time was medical librarianship. But as the field evolved, the field of medicine and healthcare, and we saw that there was a greater demand for informatics competencies and skills of our graduates. We also have in our program, not only the medical librarianship program, but also we deal with the health informatics side of things. Now, we look at this, and this is all based on the demands that we see in the workforce that we're supposed to put out with our graduates, what kind of skills and competencies that they have. All right, next, please. So what you're seeing here is that the Health Informatics Program, it has some national rankings. And I just mentioned to you the medical librarianship aspect as well as the informatics side. And we're ranked number 6 in health librarianship by US News and World Report. And this is specialization, this concentration has been very successful for us in recruiting a lot of the domestic students. And us also, we had just been ranked number 15 by Advocate in the list of the 2022 best master's programs in health informatics. And so we're extremely pleased about this because this also is a reflection of how is it that our curriculum have become so innovative. Next, please. So one of the things that you have to ask us is that, okay, how is it that we perceive health informatics at UNT? Because with years, it has really evolved as well. And so we look at the American Medical Informatics Association, and we all agree that it's multidisciplinary. And this field, it really, for us, it relies heavily on the principles, techniques, and methods, and so forth from computing science, and with the merger with information science. And the ultimate goal, and we always keep this in mind, if you look at our mission and the goals that we set up for our program, it is that we want to improve the health of our society. And we look heavily in our communities and what is it that we can do, whether we're dealing about every aspect of the healthcare cycle. And as you can see in the transparency, we're looking at the discovery, where is it that the research is happening, as well as the prevention, because we want healthy communities, the diagnosis, the treatment, and then the prognosis. So we have students that when they graduate, they have selected one of these aspects that they want to emphasize in their career. And we look at the degree plan based on what the course, the pathway that they want to take. Next, please. So what makes us unique? Well, we like to think that one of the things it is that we have an innovative online curriculum. And this is the key word right here. We have the term online. Our program is delivered online, the whole program. But the next thing is that we will say it's an evolving program, it's fluid. We look and see what are the demands. For example, we have included a number of courses right now dealing with data science, health data analytics. We are done with machine learning. We are done with genomics. We have units dealing with robotic medicine. And so the curriculum, as you could see here, we look at it, and this reflects also the expertise that we have in our faculty. Now, saying that, I would tell you that we do not rely only on the College of Information. We have wonderful partners. For example, at UNT Health Sciences Center, we partner with the School of Public Health. We have with the College of Engineering. We have here the College of Public and Health Services, and specifically in there, we deal with the program of Health Service Administration. So when we look at the curriculum, we look at the needs of the students, and sometimes we provide options that they haven't even thought about it. I think the other thing that we have been, I would say, very good, it is organizing educational activities. For example, we have what we call the Health Informatics Lecture Series. And this is something that we bring experts in the field every semester, the fall and the spring, at least 2 of them. And one of your speakers tonight, one of your panelists, they have organized, thanks to him, we coordinated, and he's bringing one of the speakers that will be addressing our health informatics students at 7 o'clock. And so that's one of the things. The other thing that we have a brown bag lunch every Wednesday, and that is research focus. We have faculty, not only from our college, but from other areas as well, that present the research, and it offers an opportunity for our students to see what kind of collaboration they can be and expand their knowledge about research opportunities. And that goes along with the second thing. The other thing, we have a very nice collaboration with industry, academic health sciences centers, and so forth for the students to carry out projects. In terms of caring and expanding the faculty, we think that there is a faculty that is really student-friendly. We're here, pedagogically, we take pride to see that the students succeed in our classes. But one thing of great interest to you all, it would be that even though we are in the 20s, our faculty, we are hiring 11 new positions for the spring as well as the fall. We have a very diverse student population. And when I say diverse, it also includes the subject domains. Like we mentioned, they come from social sciences and the humanities and so forth. But we have a very large number of students that come from the healthcare domain, whether it's pharmacy, nursing, medicine, and so forth. And that also, as we look at that, that has really had an impact on our, I would say, our curriculum. We have scholarships and research assistantship, and that is increasing as well. all the time the number of offerings that we have. I think that we have one thing that we take pride is that even though there is an incredible infrastructure for the advising of the student, we see that the student get individualized advising as well and mentoring. And the mentoring goes seeing how is it that they become leaders and how can we embed them in professional association. We assist with that. So as you can see, we look for career opportunities. We are a good link in there as well as professional association and resources. Okay, the next, please. So we thought that some of you would be interested to know, and these are some of the research that I have been in. I'm involved right now in every single one of these, and you can look at it in the screen. But one of the things that is important is to show you these are collaborative projects. We have faculties that some of them, they are part of the College of Information, the Department of Information Science, but some of them outside our department, not only UNT, but also, for example, with agencies such as the network of the Library of the National Library of Medicine, the Region 3, which is at the UNT Health Sciences Center. And one of the projects that is listed here is one that we're doing right now with them. So we make a point to reach out for these partnerships because it allows the students to get the experience to work in collaborative environment. Next, please. So now that you have known a little bit of what UNT has to offer, I think it's good that we move to the panels. And we have 4 wonderful individuals that they're going to be talking to you. And notice that the careers that we have focused tonight in today's program is dealing with health informatics. That doesn't mean that we have some of our other graduates, for example, they can be clinical information managers that they have been working in a hospital, or resource managers or informationists in a hospital, or dealing with consumer health for the VA system. So tonight we have 4 individuals that we are so pleased to bring it to you. As you can see, first it's going to be Angela Piccola, and then we are going to do JT, Lauren, and James. And the first one were Angela, you're ready, and we're so pleased to have you here. And we are ready to listen to your experience at Houston Med Study.
Thank you, Dr. Cleveland. So as Dr. Cleveland said, I am an application analyst at Houston Methodist. I am a graduate of the Master's in Information Science, particularly concentrated in the Health Informatics program from 2016. And then I also completed the Bachelor of Science in Information Science in 2014. Next slide, please. So just some kind of background, kind of throwing back even to like Dr. Cleveland's presentation, that I think all of us kind of have a passion for healthcare and helping individuals and helping patients wherever we can, depending on the users and demographics. So I've always had a passion for healthcare and helping patients. UNT's program was kind of the key for me to shift my focus into that health informatics space, meaning that kind of like I didn't even realize that this was a career field or a pathway. I originally kind of had the intention of almost being pre-med to a sense, then going into medical research, then going into kind of library and almost a medical library role. That kind of just changed, and kind of depending on the classwork, it actually changed my mindset of like what I wanted to do for my career. So as I kind of went through the program, one of the kind of classes that really stood out to me for perspective was medical informatics, that helped me to kind of see that they have job opportunities in EMR for setup, for application analyst opportunities, for helping be on teams that give impact directly to the patient, and being on teams that do treatment, and overall being able to help in a healthcare organization. Next slide, please. So kind of my career history that kind of led me to like my current role. I was originally in my former roles before I joined the information science program. I was in that pre-med medical science space of, I was a microbiology assistant. I was a research assistant working with mice. I kind of transitioned for a little bit to be a freelance writer. And then once I entered into like the bachelor's program, I was like a kind of a library role at a military library down in San Antonio. And that was great in the sense of I got a great exposure to, you know, OCLC for connection client, for, you know, interlibrary loan service, being exposed to different like softwares like Millennium for check-in and check-out, and like learning patron systems and kind of learning my local demographics, my local patronage. At that point, I kind of was going through the health informatics program and being exposed to that material, like the medical informatics degree or the medical informatics class. And then I realized, oh, this is actually a career field we can get into. So I started applying to EMR kind of opportunities around my area. And I actually got accepted to introductory associate program for the clinical information systems analyst opportunity. And I've done that I was that for over 5 years. And then I recently transitioned over to application analyst opportunity at Houston Methodist. Next slide, please. So kind of the job responsibilities that are shared from that clinical information systems analyst opportunity to the current role that I'm in for application analyst. You work on various teams. So I started off in that clinical role as a front-end scheduling referrals analyst. So that would help with like check-in, check-out, scheduling, doing referral build of how that would be electronically sent or how that would be faxed to your doctor's office. I'd also work on interoperability sharing for how that information would be, your information was shared from your patient records, how transition of care would occur, continuity of care would occur, so that you would have information, say if you went to the emergency room quickly and they could be looking at your data from like 6 years past and kind of really being able to reconcile that information to appropriately treat you quickly. Kind of supporting that system configuration. So a lot of testing, monitoring, troubleshooting workflows. So with testing, we do like updates, upgrades that you kind of want to keep in mind for workflows in your system, like how OB-GYN works, how say like, for inpatient or outpatient, how those workflows go. And also monitoring opportunities, say if we got lab results and they're not filing correctly to a patient's record, you want to just keep that in mind. And overall, just troubleshooting workflows of you just need awareness of how your system's built and kind of configuring things. So also kind of the opportunities there for collaborating with other teams to develop a project and go live. So you would have, I worked on like that front end piece and I've worked on interoperability and clinical, but then there'd be like billing side or registration side that there would be multi-practice opportunities where you could work with the providers themselves to build things out and build things that could kind of help your system. You'd also kind of be an expert or SME, so a subject matter expert. So you would train users on the system and kind of show best practices of like, the vanilla product of this is how you're supposed to be working the system. And also teaching like, tips and tricks to help them work efficiently. And interoperability, again, just to share patient information electronically. Again, just because we live in a modern age where it's that instant gratification of, you just want to make that as quick as possible to share information and also have that data readily available to you. So that's a little bit about me.
Well, thank you, Angela. This is having very informative, and especially the breadth and scope of your responsibility. So now, thank you for that. JT, we would like to have you next.
All right, good evening. My name is Jatarius Durden, but I also go by JT. And I'm currently a TB data manager with the Texas Department of State Services. I currently operate within 2 regions within the Texas Department of State Services. So we refer to them as Region 2 and Region 3. That covers pretty much the Dallas-Fort Worth Metroplex and counties as far west as about Lubbock and just south and just east of the Metroplex. Essentially, I handle everything that has anything to do with TB data. I process it. I built the databases that handle it. I also produce the analytics for everything that goes on for TB surveillance. One of the things that I've been, I guess you can say, fortunate to be with is I've had progressive leadership that's kind of allowed me to utilize my informatics skills to the way that they best fit me. Fortunately, they see and they understand the value of informatics and what they can bring to a public health organization. So when I first joined the organization, things weren't as modern as they possibly could have been, or maybe we weren't utilizing a lot of resources that we could have. And they've kind of just let me just take what I need and just run with it. If there's any kind of resource or anything that I need, they allow me to do that. And I was able to implement more modern analytics tools, revamping the TB database. And then, of course, since I graduated in 2019 with my master's degree, coming out in 2020, as we all know in public health, what's the biggest thing that took place in March? Everything shut down, the pandemic took place. So then from there, I was brought on to COVID-19 operations. And with that, what we did is COVAC equity reports, and also, hold on, let me pull up my notes here. And also referring to key stakeholders, we're providing them with reports of that what was going on within their jurisdictions with COVID, so such as the numbers, confirmed deaths, and things like that. The interesting thing about being a health informatics professional in public health is that you often take on multiple roles. You're not always seen as just a public health informatics individual. Yes, you do handle databases. Yes, you do handle data, but also you're going to be wearing multiple hats. So there are some times where I'm acting more so as a traditional epidemiologist than I am as a public health informatics individual. Or, if they need hands on deck, I'm going out and I'm doing, community health education. But what the UNT program has taught me is to always be flexible, always be adaptable, because information science is an ever fluid career field. And so with the same with public health. And so I was able to bring forth a lot of those tools and skill sets that I learned at UNT with being flexible and adaptable, and then applying those into my career in public health. And it has allowed me to be successful and to be able to have foresight on potential issues that may arise with how we collect our information, how information is being presented, what data should be stored, what data maybe we don't need, and we can not maybe collect that. And that typically kind of goes more into like health information privacy concerns, and we can go deeper into that on another note. But other than that, that's pretty much everything that I do with um, the Texas dishes. As far as UNT goes, UNT helped me in regards to my health informatics career. So how I got into health informatics is that I've always been a public health professional. I started out in the Air Force, I was on active duty, did public health. I was a medic my entire career, got out. I wanted to get more into like more tech focused roles. Uh, Started to get into those roles, but then also still wanted to be of service to my community. And so then I stumbled across health informatics. And it just so happened that since I was a UNT graduate, we also had a health informatics program on campus. And so I applied. And it was a wonderful program. And one of the things that I enjoyed the most about it, with me being a public health professional prior to getting into the health informatics program, is the flexibility of the program, which allowed me to actually take courses at the UNT Health Science Center and actually further my education in public health as I was going along with the health informatics program. So I was also not only investing into my prior experience, but I was tying that into the new experience that I was also gaining. Um, Other than that, I think that's everything that I have. If you have any questions, feel free to ask me. I have a lot to talk about, especially in the world of public health informatics. So
Well, thank you, JT. It was extremely interesting to see how you brought your background into play here. But I'm glad that you mentioned, and that's one of the things, because you took courses at UNT, Health Sciences Center, which is, one of our partners. And this illustrates to the groups, those that are thinking about going to UNT, the flexibility that you mentioned, and that we take pride in looking at, look at your background and what is the career goals that you have, what pathway you're going to have. Well, thank you for bringing that up. So, Lauren, I think that, great. Lauren Buendia, and we're looking forward to hearing you.
Thank you. My name is Lauren Buendia, and I am a research information scientist with Abbott Laboratories. Go to the next slide, please. So a little bit about me. I was born in Panama, but raised here in El Paso, Texas. I graduated from UTEP here in El Paso in 2009 with a Bachelor of Science in Biology. And kind of like Angela, my goal was to be kind of pre-med, but it was actually pre-vet. And so I was kind of really interested in doing that until I found out how much it cost. And then I was like, I can't do that anymore. So my mom happened to be getting her master's at UNT, and she had attended a meeting that Dr. Cleveland had been in. And she said, this sounds perfect for you. You love books, you love literature, but you're also very science focused. So I think this would be a perfect match for you. And so I looked into it, and sure enough, it seemed to be the perfect fit for me. So I applied, and as soon as I graduated with my bachelor's, like within 5 days, I started the master's program at UNT, and I did it, as Dr. Cleveland mentioned, it's all online. which was perfect because my husband had been accepted into medical school. And so we had to move to Houston. And so that allowed me to stay with him and still kind of further my career. So I did a really fast master's, and the best part of that for me was not only just being able to connect to, Dr. Cleveland, like she's always available, but also there were other folks in Houston that were also in the program. And so they would come down and have like a big meeting, and everyone who was in UAT and located in Houston could go and meet each other and talk to each other. And so that was kind of an opportunity to make you feel like, you're actually a part of an organization, and there are other people in the city that you live in who are actually participating in this remote learning. And so that was really great for me. And then also the internship. The internship was actually life-changing because I started interning at the Texas Heart Institute prior to graduating. And I remember so clearly, we had a physician come in and he was like, I need to do a literature search on, I don't know, something heart-related in patients who have diabetes or something like that. And I was like, wow, and then I got started doing it on, I think it was PubMed or Scopus or something like that. And I was just like, wow, I wish I could make a career out of this. And I think about that all the time because that was my dream at that point, and I didn't know it existed until I took more classes at UNT, that you could actually make a career out of just doing literature searches for people who need, scientific and medical information. That was just astonishing to me. So after I graduated, within about a year, I just happened to find a job at Abbott Laboratories for exactly what I wanted to do, which was just being a research information scientist, just doing literature searches all day to support a company. And so I joined in 2011, and then I've been there ever since. So just a little bit about Abbott. I'm sure you guys have seen the commercials lately. They've been really pounding those hard on the TV. So we're a pretty big company. Some of the big products that you guys are probably aware of are Freestyle Libre, which is for diabetes patients. We make Ensure, Pediasure, Pedialyte, all of that stuff. And then also more recently with the COVID stuff, we came out with like 6 different COVID tests, and the ones that you can get in the store are the Binex now. And so basically those are the big products that we're kind of known for out in the world. But we're headquartered in Chicago, and we have 4 major business units: medical devices, diagnostics, nutrition, and branded generic pharmaceuticals. And another key thing that I didn't mention before, when I got hired, the job was actually for somebody to move to Chicago, but because I had the experience of doing coursework online, which was kind of, in 2010, that was kind of like unheard of, and a completely remote master's program online, I could kind of sell myself as being a remote worker, since I knew I was going to be all over the place, with my husband going to different areas of the state and stuff. And so that knowledge and that experience of working remotely, having responsibilities, being able to collaborate distantly, all lended itself to me becoming a completely remote worker. And so I work remotely from El Paso, Texas, even though the headquarters are in Chicago and everybody else is in Chicago. So next slide, please. Within Abbott, as an information research scientist, I am in charge of the subject matter expert for the cardiac rhythm management, the diabetes care, the electrophysiology, heart failure, and neuromodulation divisions, but we all kind of do a little bit of everything. And so we all have familiarity with all of the different divisions within Abbott. And so we can kind of hop on if we have a request from somebody internally who needs information that's not from a division that we actually are the SME for, and we can just perform it and know what to do. So 60% of the things that we get from internal clients, like scientists, people working in R&D, HEOR, the most that we get is probably from regulatory affairs. And that's just to kind of not only to make sure that we can launch a product and get it approved before it goes out on the market, but that it stays on the market, and that we just kind of, follow up and make sure that everything is okay as far as the product goes in its life cycle. And like I said, product approvals, surveillance, regulatory submissions, but I also do it's kind of like a newsletter, but it lives online. So it's basically just news updates on the diabetes care division, but also in the industry as well. So that way people who are in the diabetes care division within Abbott, they can refer to the news alerts and kind of stay abreast of what's going on in the industry. And then I also train and mentor new biomedical researchers. And I think that's it.
Well, that's a lot, Lauren.
Yes. And I tried to do it fast. I was like, oh.
No, very nice. You're doing a great job.
Okay, thank you.
That I'm glad. I mean, I'm trying to pick up something of each of one, but of you. And you pointed out your internship, which I think is important because that's one of the things that we are even expanding more and more the site, because right now, like I told you, we have a different, it's very diverse, our student population. So where is it that we face this where we place these individuals that they are, come with a healthcare domain? And so it is important to know that that's one of the opportunities that we offer. And you have given an excellent example. The other thing is, even though the position was not remote, how was it that you used your experience to sell the idea of what you could do? So I think that's also important for those that they're listening, potential individuals that might look for UNT to see how our program can be an asset to it. So thank you for that. So Jim, Dr. Spence, we're looking forward to hear your presentation.
Oh, thank you, Dr. Cleveland. First off, I would like to thank Dr. Cleveland, and I would like to thank Janine for putting tonight's program together. What a wonderful opportunity this is. And Angela, from the picture here, you can see Methodist just right across the street. So Angela and I are neighbors right there in the Texas Medical Center. So next slide, please. So as Dr. Cleveland mentioned, my name is James Spence, but my lifelong nickname is Jim. So everybody calls me Jim. And I received a bachelor's degree in computer science from Texas Tech University. And then upon working with a wonderful colleague who was a librarian at the time named Leah Crevitt, who is now retired, I became interested in information science. I mean, it's just as simple as that. And then through that introduction to Leah, I then met through Leah Dr. Cleveland. And the rest, shall we say, is history. So I enrolled in the master's program in 2008 and graduated in 2011. And I stayed in contact with UNT just because of the strong ties as an alumni, and of course with Dr. Cleveland. And I shared with Dr. Cleveland that I would really like to continue my education, and I wanted to know more and do more. And she simply said, you need to enroll in the PhD program. And so the rest was kind of history in that regard as well. So I started the PhD program, I believe in 2012, and then finished in 2018. And it was a wonderful opportunity to study very specific things that I was interested in my dissertation. And in terms of work experience, I worked for the University of Texas School of Dentistry for 8 years and served as a technical project leader for their EHR implementation. And then after that, of course, I came to MD Anderson in 2008 and I started off there as a systems analyst, and then received a promotion a few years later to a manager's position in the division of pharmacy, overseeing all analytics work for the entire division of pharmacy. So the pharmacy analytics team provides data and analytics services for the entire institution. We don't just serve the division of pharmacy, but indeed all of MD Anderson. And an institutional help desk was set up and branded To Know whenever we went with our electronic health record Epic in 2016. And the whole concept behind To Know is basically it's a help desk for anybody requiring informatics or analytics services within the entire institution. So our team, the analytics team in the division of pharmacy, is responsible for all analytics services of the pharmacy subject area. So if anybody calls To Know, emails To Know, puts a self-service ticket into Tuno, it comes to our group and we process that. So I'll get into more detail on that in a minute. So next slide, please. So with regard to MD Anderson Cancer Center, as you know, or may know, MD Anderson is a large oncology healthcare system. It is more than just the single hospital and the medical center, although our main hospital is located in the Texas Medical Center in Houston. We have 5 Houston area locations within the greater Houston area, and there is also an MD Anderson Cancer Network, which is comprised of partnering hospitals in the US and indeed abroad. So MD Anderson's primary objective is quite simply to end cancer. It's in all of our branding, it's in everything that we do. Our sole purpose for existing is to end cancer. And I wanted to provide a few statistics with you regarding MD Anderson. So MD Anderson, as I may have mentioned before, has been ranked #1 in cancer care in the US for the past several years. And I think over the past 10 years, it's been ranked #1 9 times or something like that. We kind of go back and forth sometimes with Sloan Kettering, but so MD Anderson has a very good reputation nationally. In terms of patients, and this data is about a year old. We haven't published our most recent annual report, but if you're interested in the information on the annual report, it's in the references slide at the end of the slide deck, and this is where this data is from. But in last year, we saw 151,133 patients. We had 1.4 million outpatient visits, 18,000 surgeries, and enrolled 8,279 patients in clinical trials for research in various pharmaceuticals and other types of research protocols. In terms of our workforce, we have over 22,000 employees. Of those, 1,788 are faculty, and these are our physicians, our providers. We also, of course, are affiliated with the University of Texas, so we are a teaching hospital and currently have over 5,000 trainees. And we also have a very large volunteer presence, which took a bit of a hit because of COVID-19 and not having as many people on our campus. So we have, over 800 volunteers at any given time. And one moment, please, I need to move my window because it's sitting on top of one to look at. And in terms of operations, we have a $5.4 billion operating budget, which is fairly staggering. And of that, close to $1 billion is spent annually on research. And my apologies, the last 2 lines are duplicate. Those shouldn't be there. So next slide, please. About pharmacy analytics. So this is kind of drilling down into the area that I actually manage and we work on with our team. And so as I mentioned earlier, the pharmacy analytics team receives the majority of its requests from the institution's Tuno or information help desk process. So in essence, everyone and anyone in the institution can request pharmacy data and analytics, and we will work with them to fulfill those information needs. The types of requests that we receive are varied, but some of the most common are to support the medication use process. So the medication use process involves the medication procurement, storage, prescribing and ordering, transcribing and documentation, dispensing, administering, and of course, monitoring over time. Data and analyses also are there to support the supply chain of pharmaceuticals, inventory management, lately a lot of medication shortages, other programs in terms of medication stewardship and predictive analytics for shortages and financial performance. And last but certainly not least is to support research. Such analyses include patient cohort identification, medication and lab related analyses, and of course, patient outcomes reporting. Next slide, please. So to give you a sense of the volume of requests that our team handles on any given basis. So since the go live of the institution's EHR in 2016, our department has completed well over 1,500 analytics and information requests from across the institution, serving over 100 distinct departments within MD Anderson. And the simple graph below simply shows the number of requests received during the most recent fiscal year from September 1st, 2020 to August 31st, 2021. And on average, we receive about 25 requests per month, basically one or more every working day. And then, of course, some of the data and analytics requests are fairly simple, while others may take a few hours. Others are quite complex, which may take a few days, weeks, or even months. So there's a wide degree of variation with the level of complexity and analytics that our team produces. So pharmacy data and indeed information is crucial to improve the services we provide to our patients. And I would like to share with you a passage from Dr. Cleveland's medical informatics text, which has stuck with me ever since I read it. So she states, information fuels healthcare endeavors. Timely and accurate information is essential at every part of the healthcare continuum, from the patient to the highest levels of healthcare management. And that to me has become almost a personal mantra, because obviously what we do is most important to the patient, because that is the number one reason we are there doing what we do, is to cure cancer and help our patients deal with the cancer diagnoses, and in so many cases actually recover from a cancer diagnosis and live healthy lives. And the other thing that has become very apparent to me is that really authoritative and timely information can literally make the difference between life and death. We have seen that in the COVID-19 pandemic, the importance of information, the importance of accurate information in terms of vaccines and public health initiatives, et cetera. So I would like to thank you for your time today, and I sincerely hope that many of you will consider a rewarding and incredible opportunity to take a career in the health information sciences, in health informatics, and health analytics, the various pathways that have been described to you tonight. So thank you for your time, and I appreciate the opportunity.
Thank you so much, Ian, Dr. Spence, for your presentation and show the scope of what you're doing related to pharmacy informatics. And I think one of the things that was good, it was to highlight the data analytics, that it goes into that department, and everything ultimately is going to be for improvement in patient care and patient safety, as we all know. I want to say that the quote that you have, I really sincerely appreciate it, but I had to say that this was something that Don Cleveland and myself worked together as a team, as you will know. And that was part of one of the books that we wrote together, dealing with health informatics. So thank you for putting that there. And I think that also shows our own philosophy of both of us dealing with healthcare. Also, I want to take this, and we're going to go to the question and answer period, but I want to take a total disclaimer about the fact that so many times you have mentioned my name. And this was not part of the plan when I asked you to engage you to be part of this presentation. But I am going to take advantage of it since you all brought it to the table. And what I hope that this indicate, illustrate, demonstrate to those in the audience that are considering UNT, to show you what I mentioned in the one of the slides, that is the advice that you can get from the faculty, the mentoring that you can get from the faculty. And I think that signifies what UNT and the Department of Information Science and the Health Informatics is all about. So thank you for setting that, because it allowed me to, you all demonstrated, but something that I said. So now, first of all, thank you to each and every one of you, and you were selected, each one to demonstrate a different, illustrate what is it that you're doing in your job, and it's absolutely fascinating. So I would like to open it now for a question and answer period. Those of you that are in the audience, we have a number of participants. I want to see if anybody have put questions in the chat. And if not, unmute yourself. Okay, we have a question here in the chat. What are some ways someone who is coming from an information science tech background can get involved in health informatics? So any of the panelists that would like to tackle this, they come from IS and they have a tech background, what they can do. And I think a lot of you have demonstrated in your jobs, but it would be great if you give them some advice.
I'll just say for myself, like I think like even from Lauren's perspective, it's that internship, it's kind of getting into the door wherever you can of just the involvement and the passion that you kind of show that you love patient healthcare, you love patient satisfaction, you love something specific that you know you're trying to get into the door for of you want that experience, you want that knowledge, you want that networking opportunity. And for me to get into my role, I was completely, as I kind of showed my like trajectory of like my jobs, like I didn't have that IT mindset before I even jumped into it. So it was kind of cultivated over time. And a lot of places, they'll give you the opportunity if you have that master's degree, if you have a health informatics degree from a good established program, they'll kind of, that's the gateway to get into the door of, you know, oh, I see that you kind of have analytical skills. You've taken medical informatics. What can that be applied to here at this organization? So it's always an opportunity, I think, and especially for entry-level or associate, once you have like a master's program behind you, that kind of established background, I think it gives you kind of the keys to the kingdom and a little bit of the jobs out there.
Angela, I think that that's a very good advice. I think a lot of you learn on the job, but you know, your degree sort of, you know, and your internship, as you have mentioned, but also there are all kinds of things nowadays that we can do with certificates, you know, webinars, and so to enhance your knowledge base. And then you can mention that once you're in the job or when you're applying. Good point. Okay, do we have any of the other panelists that would like to give advice to prospective individuals that will come to this field?
I would mention that don't be afraid of entry level positions. Even if you may not have a background currently in health informatics or you know in the health sciences, because when I started in healthcare, I didn't. I actually was working for an insulation contractor and took a job at the University of Texas Dental School because I wanted to be closer to home. So, you know, and then got the bug that way. So, you know, and then pursued degrees and, you know, kind of worked through promotional, you know, opportunities and those types of things. So I would just say for those of you that have a technology background that may not necessarily have the healthcare background, you know, maybe look at entry-level positions in hospitals or in healthcare systems or in public health arenas, in libraries, in, you know, health sciences centers, because a lot of those are good stepping stones into better and different opportunities.
That's very good advice.
Yeah, I completely agree. This is Lauren. I think even volunteer work at a hospital library or, you know, like the interning or whatever, just shadowing somebody for a day or so. I mean, anything that you can get a little bit of experience and exposure to, I think that's going to make a huge difference, especially when you're going and you want to apply to a job. You can say, hey, you know, you can show them on paper, I spent a couple of days here, I spent a couple of weeks here trying to get some experience. I think that's the key. And one of my managers recently said, just the combination of having a little bit of experience in either the information science or the biology, you know, the biological background paired together, it's like finding a unicorn. There are not that many people out there. So if you just take the initiative just to do just volunteering or anything like that, that's already going to put you ahead of the ball game.
I don't know, JT, do you want to say something in here about some advice?
Yes,
Please.
I was pretty much just piggybacking on what the panelists said.
Right.
Internships are always a great opportunity if you're going to want to expand your professional experience. But since the question is if you're closely aligned with information and computer science, then the biggest thing that you want to create an impact on is your interest in healthcare. Because that's going to be the biggest thing. With as us being health informatics, yes, we are information science, computer science professionals. We are in the game of analytics, as Jim is and I am. But at the end of the day, your focus first and foremost is going to be the patient first. So it's always expressing that and getting the employers, your future employers, to understand what your mission or what your goal is in crossing into health informatics. And fortunately now, with everything that's going on, there's been a positive light that's being shown on informatics because there's been a lot of information. A lot of organizations need that information. There's a lot of information coming in. They need help processing that information, and individuals that are going to be there to help them make decisions in order to provide better healthcare. Um, and so I think that with that being said, there's a lot of entry level in internship and also fellowship opportunities. Inside my field for public health, there's a lot of fellowship opportunities going on at CDC out in Atlanta. And I'm even starting to see more opportunities pop up here in the Metroplex, where maybe you didn't see as much public health informatics opportunities. So the opportunities are coming. Just kind of keep an open mind because as you are inside the health informatics program, it covers a great deal of topics. And so just kind of keep an open mind on where you want to go with your career. Don't limit yourself into a small bubble or a role of what you may think what your ideal job is going to be. Always keep your horizons broadened with your job search and the individuals that you may come across and the connections that you may make.
That's great. Great, JT, great thing. But I'm just going to put my my thoughts in here. For one thing, I always have been very technology oriented. I love the idea of the gadgets thing and how do you look at technology. And I always had an interest in medicine, in healthcare. I was very close to one of my uncles who was an MD. So I started getting intrigued about how was it that he kept up to date? How was it that he took care of his patient? What kind of information he was giving who to the patient? How that was delivered, in what format it was done. So I started thinking about it. Okay, I have this passion for technology and medicine, and how is it that these two things can come together, and what was the field? And since my degrees were in mathematics, I had a wonderful opportunity when I did my studies that there was a strong collaboration with the medical school. So I even had to take a course in my master's program, Introduction to Medicine, in order to understand the culture of who I was going to be serving. So I would say that the existing evolving technology with scientific development, it was to me that it was something that it became, I was intrigued, I was a source of motivation. And so this is what I found. And I found this particular field of health informatics. The ultimate thing to me, to be honest with you, is to think that I can have impact in patient care. Whether it is by presenting evidence to a healthcare provider or by educating a patient and see what is the health literacy of that patient so they will understand something. So it attracted me, one, because of the subject domain that I was going to be dealing with, but also I saw there was a number of career opportunities that they were available. And I am a person that I thought, well, I might not want to do this for the rest of my life. So I knew that there were options to me. And I think that that's important for also those of you that are coming to it, that, there were career options. And I also like to work, and most importantly to me, in a collaborative environment. I am a team person, and I had known that since I was in high school, in my class of physics and chemistry and so forth. I used to love to work in the lab with people. And this field also provided that. So I think that you need to know something about yourself and what is it that you feel you can contribute to. And that's going to motivate you to keep working on it. So that was one of the things. And I always mention that to the students, see what is your passion, what motivates you, and that there are options to you at the end, in the pathway, in the journey, in the career. So Do we have any other questions or comments from the panel? Do you want to give sort of like I don't see any other questions in the chat at this point in time. If someone want to post something else, this is the opportunity. And
Dr. Cleveland, I'd just like to echo what you said about teamwork and working on teams. I think those of us that are in healthcare, I mean, there's not a project I work on that I'm not working with other people. I mean, it's just so collaborative, the healthcare environment. And, you know, we rely on each other for, you know, rely on the pharmacists in our division for pharmacy expertise. I rely on our technicians for, you know, operational expertise and pharmacy expertise from time to time. They rely on me for, you know, analytics and statistical expertise. And so, you know, there's just, if you enjoy that kind of fast-paced teamwork kind of environment, healthcare information and information work is an incredible place to get that, to do that. So just my 2 cents.
well, thank you, Dr. Spence. So, well, I think looking at the time, I think we're pretty much on target. I want to take this opportunity to thank each and every one of you, and I'm going to do it in the order that you presented. Angela, thank you. And I also want to say that you also used to work in Fort Worth, in San Antonio, in a healthcare, you know, in the Academic Health Sciences Center. And notice how you have moved now to Houston Methodist. So just do this to show, to support what I just said to the group. And JT, thank you so much. And JT actually is in Austin for your presentation. Lauren, thank you for your comments on remote work. Dr. Spence, as always, thank you so much out of Houston. And as we know, medications are so important part of our everyday life. And we appreciate the skills and competencies that all of you have presented. So with this, I think I'm closing on behalf of UNT, and I hope some of you that have come to the presentation tonight would like to inquire more about our program. I have put my contact information, and best of luck to each and every one of you. Good evening.
Thank you.
Thank you.
Thank you.
Thank you for your time tonight.
Good. We got, do you see the chat?